Hello, my name is Shannon McKinney, and I will be presenting my literature review presentation on Parkinson's disease and fall risk reduction. The purpose of this review is to locate and identify evidence-based research from various journal articles to determine the utilization of exercise and physical therapy measures in reducing fall risk amongst patients 65 and older with Parkinson's disease in comparison to traditional practice. Research topics regarding Parkinson's disease and fall risk include the role of exercise and physical therapy in reducing fall risk amongst Parkinson's patients. Studies comparing traditional treatment plans focus on the use of medication and lessening the symptoms related to balance and gait issues, which are prominent in the disease development. Subtopics include exercise programs combining balance training and education to determine the role of exercise and physical therapy methods in reducing falls. Parkinson's disease involves neurodegenerative disorders affecting specific areas of the brain. Patients with Parkinson's are linked to increased fall risk due to the nature of disease symptoms. The Liberty Library Catalog, peer-reviewed journal databases, and academic websites were utilized to analyze and explore studies relevant to the topic. Advanced search strategies included the use of Parkinson's disease, fall risk, and keywords related to exercise and physical therapy. Evidence-based research from systematic reviews and randomized control trials provided support for best practice procedures to allow for informed decision-making on Parkinson's disease research. Exercise and physical therapy programs in reducing fall risk. Examination of the literature shows gaps in fall prediction and treatment amongst Parkinson's patients due to gait dynamics and the multifaceted disease symptoms. In addition, studies comparing exercise and physical therapy treatment options as measures of decreasing the prevalence of falls show mixed results. Physical therapy approaches study gait patterns, extending the scope of research towards factors contributing to walking and standing formation. Review of the literature suggests exercise interventions and playing a role in increasing the physical and physiological health of Parkinson's patients, which contributes to disease rehabilitation. Reviewing subtopics related to exercise intervention, characteristic methods prevents varying conclusions related to fall reduction. Programs combining balance training. Exercising and physical therapy in reducing fall risk amongst Parkinson's patients has been studied showing varying results in fall risk reduction amongst exercise groups utilizing physical therapy techniques. One study found that supervised exercise targeting balance factors reported no significant difference between groups in the rate of falls. However, in the lower disease severity subgroup, there were fewer falls amongst the exercise group compared with the control group. This study suggests the role of disease severity in determining the effect of an exercise intervention in reducing falls amongst patients with Parkinson's disease. Increased physical outcomes related to balance and gait were reported amongst these studies. The researchers suggested that fall prevention protocols are dependent on factors related to balance training environment and disease severity for programs combining balance training. Programs combining balance training and education. Exercise and physical therapy interventions, when mixed with fall prevention education and balance training, resulted in 85% fewer falls compared with the control group. The authors suggested that both an educational awareness and exercise program contribute to factors that limit falls, such as strategies for safe functional mobility or balance reaction methods. Cognitive and physical risk factors in reducing fall risk. Cognitive issues can increase depression rates amongst Parkinson's disease patients, which reduces motivation to participate in exercise activities, thus increasing fall risk. Research identifying cognitive and physical risk factors related to Parkinson's disease aids in reducing fall risk. The authors suggested that intervention efforts merging both physical and mental fall risk factors amongst Parkinson's disease patients will decrease the overall prevalence of falls. A review of the literature identifies the importance of emerging physiotherapy, balance exercises, and education to reduce fall risk in Parkinson's disease. Researchers in a randomized controlled trial reported the importance of integrating cognitive strategies and balance training in reducing falls. The authors from the studies suggested the importance of further research studies in addressing alternative methods for Parkinson's treatment aside from medication. A significant number of researchers reported insignificant effects of physical therapy and exercise in reducing fall risk. Difficulties in developing accurate fall risk prediction models and methods highlights the complexities surrounding fall risk and the gaps in Parkinson's disease research. Most of the current research suggests that the role of physical therapy and exercise in reducing fall risk in individuals diagnosed with Parkinson's disease remains inconclusive. However, a review of the literature suggested that physical therapy and exercise increases physical and physiological health amongst this patient population. Intervention measures utilizing evidence-based practice to study the obstacles related to Parkinson's disease are important for clinical application. Determining the best process for healing and lessening disease symptoms can be difficult, but God guides us in determining the right path. Jeremiah chapter 33 talks about the promise of restoration and the process of healing from sin. God provides healing and strength during times of illness and disease. Looking at the literature surrounding the complexity of Parkinson's disease, it is evident that a variety of treatment options are available with varying results.